Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Here's what I bring to you from the world of medicine. Systematic review shows FDA antidepressants warning linked to mental health care decline and rising suicide rates in youth. The long-standing epidemic of severe pediatric depression is a significant public health concern, with only one-third of the affected population receiving any mental health care. A new systematic review suggests that FDA-issued warnings about antidepressant use intended to increase monitoring of suicidal thoughts among youth have led instead to unintentional harm. The study was led by the Harvard Pilgrim Healthcare Institute with the collaborators from the University of Pennsylvania, London School of Economics and Political Science, Northeastern University, Drexel University and the University of Sydney. The findings were published in the October issue of Health Affairs. Since 2003, the FDA has advised that antidepressants might be linked to suicidal thoughts and behaviors in young people. These warnings upgraded to a black box warning in 2005 for those under 18 and an expansion in 2007 to include young adults up to the age of 24, were intended to encourage physician vigilance in monitoring patients for suicidal thoughts and behaviors. However, experts say evidence showed they resulted in a decline in pediatric mental health. The study team screened a total of 1841 research reports published about the warnings spanning the period between January 1, 2003 and October 31, 2022. Of these, 34 measured the outcomes of the warning, 11 of which met well-recognized research design criteria. These 11 reports included studies measuring abrupt changes in outcomes, trends following the October 2003 FDA advisory and or January 2005 black box warnings. The review found that fewer than 5% of pediatric patients were monitored in accordance with FDA's recommended contact schedule recommendations following the advisory. This low rate remained unchanged from the rate prior to the warnings. Zero studies documented improvements in mental health care or decline in suicide attempts or suicides after the warning went into effect. 4 studies, including a total of over 12 million patients, reported substantial reductions in doctor visits for depression and depression diagnosis. Most studies showed increasing use of antidepressants in the years before the FDA advisory, followed by abrupt sustained reductions in the use after the warnings. 7 studies showed the relative reduction in antidepressant treatment and use ranging from 20% to 50%. 3 studies showed increasing in psychotropic drug poisoning and suicide deaths among pediatric patients. While young adults from age 18 to 24 were not included in the study of younger pediatric patients, the effects of these warnings spilled over to young adults who frequently experienced declines in mental health care and increase in suicides. Because it is unlikely that any one outside factor can account for the multiple sudden and parallel effects on depression care, suicidal behavior and deaths by suicide, the authors suggest that allowing the warnings to stand may contribute to the continuing pediatric mental health crisis. The sudden, simultaneous and sweeping effects of these warnings, the reduction in depression treatment and increase in suicide, are documented across 14 years of strong research. The consistencies observed, harms and absence of observed benefits after the black box warning indicate that this is not a coincidence, adds Dr. Somay Rai, Harvard Medical School Professor of Population Medicine at the Harvard Pilgrim Healthcare Institute. We recommend that the FDA consider incorporating the black box warning into the list of routine warnings that pose fewer health risks or potentially removing the warnings altogether. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.